South Africa's child and teenage pregnancy crisis raises fresh concerns tonight about why the numbers are so high and why children as young as 10 are getting pregnant. According to the KwaZulu-Natal Health Department, 26,515 teen pregnancies recorded during the course of 8 months. The Northern Cape Education Department reporting that 3,000 pupils falling pregnant over the course of last year until March this year, with the youngest being 10. Shahidah Omar is the director of the Teddy Bear Clinic and joins us now to help understand the profiles of the affected and what should be happening right now to change this picture. Welcome to you tonight, and thank you very much for your time. You know, we look at the research around why this is happening, because this is an epidemic that is not new to South Africa. But what we're seeing is that this is deeply rooted and complex as to why this is happening. Share some of the causes with us from your experience and perspective.
Thank you, Iman. I think, we actually have to declare this a pandemic. For 10-year-olds to give birth to a child giving birth to a child is not only alarming, it's disheartening, it's soul-destroying. We're robbing that child and the newborn of all opportunities and actually impacting on their trajectory, long-term implications of physical, psychological, and all other effects that will affect them in their lifelong span. So if we look at it, I think it's a very complex situation, and it is a systemic challenge here. We cannot isolate one single factor or risk factor or contributory factor. But what stands out for me in our engagement with children, the child pregnant learners that we are currently working with, and we are currently working with children in support groups where we've got 120 children already in our intervention programs, and some of them are still on a waiting list to join groups but are receiving individual sessions. So the one thing that stands out is the lack of communication, the breakdown in communication, the paucity of knowledge around sex and sexuality, but also the inability to communicate adequately, appropriately. So on different levels, where we find that the education authorities are, entrusted with this responsibility of providing comprehensive sexuality education. However, yes, it is to a certain degree the role and responsibility of schools. But where do the parents feature in all of this? Where do other government departments and other systems feature in this? So there's collective responsibility and collective action that is required. What we are finding is that, yes, the CSE is being provided at schools, but there's a lot of resistance and reluctance. If we look at the outbreak, a year and 2 years ago, where parents were, outraged at the thought of their children being informed about sex and sexuality. But the reality is that in our engagement with children, a lot of the young girls that we engaged with identified that their sources of information around sexual conduct, intimacy, was from friends, from the internet, and other sources. They were not informed. An overwhelming majority informed us that parents or caregivers never engaged them on the subject. So I think this is something that's obviously of grave concern. But then the other thing is, if we look at the supporting structures, we know that schools have identified that there are school social workers that are available, but this is not a reality on the ground. The school social worker that is assigned to a school is actually assigned to a cluster of schools. So just try and think of the roll numbers for children to access any kind of supportive counseling or education information. But then if we look at healthcare again, the health department, that previously in the days of yore, we had school nurses going out, engaging with children, and the importance of reaching out around healthcare, because it's not only about sexual conduct, but it's general health, I think. And that's another thing that children don't have easy access to. And if you look at the historical responses elicited by healthcare practitioners, where children have gone to for advice, counseling, for access to contraception, the responses that have been elicited are very negative and certainly have turned children away from seeking that avenue. So on different levels, we can see that as a society, we are failing our children, that the issue around communication appropriately, adequately, timeously, being sensitive and being accessible and available, the resources are not immediately accessible, available, and sensitive.
Shahidah, as you talk, it's so deeply rooted, it kind of evokes this image of an adventitious root system, which is just, the causes are so many. And some of the others that we can also cite, sexual violence and abuse, the lack of access to contraception. We've seen cases where nurses are refusing to help young people or chasing them away. Young people don't know how to use contraception, and you talked about the lack of proper sex education and also access to the termination of pregnancies. But I want to go to the most, well, not that they're all not vulnerable, but when you think of a 10-year-old, as you conceive, and you spoke about the health risks, notwithstanding the risk to their education of a 10-year-old who is, basically hasn't even lived their lives, falling pregnant. There is, a very important issue around this is that girls or, minors under the age of 12 cannot legally consent to sex. So this will always be rape. But are we seeing consequences for those children who would show up to a hospital or wherever they're going, where there are figures of authority, that there is a follow-up action around prosecuting this? This is a crime.
Indeed, and that is of grave concern, because some of the girls that we have worked with, and some of them are, believe that they in a consensual relationship, knowing fully well that we understand legally they're not in a position to even consent. However, many of them, for various reasons, whether it's transactional sex, for sexual in exchange for tokens and all sorts of other material things, they would, provide sexual favors. And in other instances, with the grooming process, where they do not see themselves as victims, but see themselves as, willing participants. And I think that is also something that needs to be addressed, because if we look at the economic situation and the economic circumstances of many families, the lack of employment and then poverty, surrounded by poverty, and of course, that these are challenges. Sometimes we have seen where children have been actually allowed and permitted to engage in these relationships for exchange of money and of course other consumables out of desperation for the survival of the family. So that's also another concern. But I think when you talk about that 10-year-old, the 10-year-old does not have the cognitive capacity, is not in a position to make an informed decision, does not have the ability to make positive choices. And that obviously needs to be addressed, needs to be monitored, and greater awareness around that, where children need to be, made understood, make them understand about their rights, their responsibilities, and acceptable.
Yeah, but still, Shahidah, I'm sorry to come in there and interject you. Time is never on our side, and there's so many different angles to the story that I wanted to talk about. But if we look at the most vulnerable, who should be protecting them? As you said, they don't have the cognitive ability to make these decisions, and the law agrees. So if their parents can't or their school can't, who is going to? Who should?
Well, law enforcement has a huge role to play. A National Prosecutions Authority have a huge role to play here. Education, South African College of Educators. I think on different levels, there are different parties that are responsible for ensuring the safety and protection of children. So it requires a coordinated, collaborated effort to ensure that children do not fall prey to this scourge of violence, which obviously is on the increase.
So many, again, just a conversation that leaves you wanting to put your head in your hands, because it is so complex. There's the issue of communities, and in some communities where reparations might be offered in exchange for a pregnancy, and there's no justice for the child. Issues around whether that primary infrastructural support around healthcare even exists, for these kids, and whether government is doing enough in its capacity to make sure that it implements what it needs to implement to prevent these things from happening, especially vis-a-vis sexual and reproductive education at school. But that's all the time we have for, and we appreciate yours, Dr. Shahidah Omar, who's the director of the Teddy Bear Clinic.